Hi, good afternoon. What I'm going to discuss today with you is the difference between minimally invasive cervical disc surgery and formal anterior cervical discectomy with fusion or with a disc replacement. Now, whenever we come to surgery, any one of us would like to say, well, okay, I don't like to have a complicated surgery. I need a short and sweet solution. So you'll find some people run away from surgery toward the solutions which they call it minimally invasive or percutaneous solutions. Now, my definition of minimally invasive surgery is the surgery which is done with a minimal risk, done once with very low failure rate. So whatever implies under this, I think this is what is defined as a minimally invasive. Regardless how big is the incision or how small the incision, and whether we have to do it percutaneously or using a laser as being advocated, etc., etc. Now, particularly with the cervical spine, I've been doing this job for a very long time, and I know the risk involved in each type of these procedures, and I always advise my patient, please do not think about percutaneous surgery in the cervical spine, because the room of error, even in a very, very, very expert hands, can be, quite serious on your health. There's many structures in the neck here, like the trachea, the esophagus, the carotid sheaths, which are in the way and can be injured in a blind technique, even if the doctor takes the extreme position. I believe the usual technique, which is a Smith-Robinson approach, is very simple. It is a direct vision technique. In that case, all of the structures which I have just mentioned are under direct vision of the surgeon. He can protect them, in which he can reach the cervical spine very easily within 5 to 10 minutes without any particular risky complication, let's say. Now, some reports have advocated that if you have an injured esophagus during this technique or like in a percutaneous way, the mortality rate and morbidity rate are very high. Okay, you're talking about 50%. So there's no joke in terms of, okay, I'm trying to save myself a surgery, therefore I will do any other procedure as being described as minimally invasive. This is for the cervical spine. Of course, minimally invasive technique is available for the rest of the spine, and that's fine. There's no risk in the lumbar spine to criticize or to avoid. Therefore, it is applied in the lumbar spine very safely. Now, another thing which we need also to discuss is a group of treatment which is like intradiscal thermal therapy, or as they advocate as a laser therapy, and that tends to be done by pain management doctor, where they insert a little probe or needle through the neck down to the cervical spine and go under X-ray guidance into the disc and produce some heat using either radio frequency or the laser, and they believe that this can treat the degenerative disc. I have to say the report or the literature does not support these techniques in a very high rate, and the best result has been reported to be in the region of 40 to 50%. Therefore, in addition to the risk which I already outlined, I do not feel it is something I would recommend to my patient, because I feel it is inferior and it does not in another way relieve the axial neck pain. Because if we are thinking about cervical disc pathology here, and the height has been diminished to a significant degree, putting a needle and burning that level is not going to restore the height of the level. In that case, there will be still axial neck pain persisting, and also the nerve root, which is like coming out from that foramen, the foramen is still tight. So I think it is a half a solution. And for me as a surgeon, do not accept half solution. It has to be either no solution or a full solution. Therefore, this is not recommended in my practice, and I do apologize to my patient that I do not carry this laser or intradiscal thermal therapy in the cervical spine at all, and I am not thinking of changing my practice in the future. I'm talking about the next 30 years at least, until I stop my practice.